You probably know that when you turn 65, you get certain health care benefits through Original Medicare, but you might not know that you could select Medicare Advantage instead. So what's the difference? And is there really an advantage to Medicare Advantage? Here, let's ask Dr. Terry Koenig. Dr. Koenig is the Senior Medical Officer of Government Programs for Medical Mutual of Ohio. Welcome to the show.
Thank you, Lori.
So before we get to talking about how Original Medicare and Advantage are different, let's talk about how they're actually the same.
Okay, Medicare Advantage must cover everything that Original Medicare covers. So that includes hospital stays, physician visits, and any of the other benefits that Original Medicare offers to the enrollees.
Okay, so that's good. They got some similarities. What's the difference?
In Original Medicare, the government, it pays the claims. The care is delivered based to the general population rules. In Medicare Advantage, the government works with insurance plans to take those funds and manage the care of the members so that they can offer additional coverage that may not be available when care is not coordinated or within a group of physicians and hospitals.
Okay, so what extra bells and whistles can they add to the Medicare Advantage then?
Well, they can add a lot of things. They can add dental, they can add vision benefits, they can add health care benefits around wellness, exercise. So there's many areas depending on the individual plan. At Medical Mutual, we offer many of the ones I mentioned.
Okay, so how do they compare in out-of-pocket costs?
So in Original Medicare, the enrollee pays the Part B premium, which is out of most people's Social Security checks,
right,
and then has co-pays or co-insurance for hospital and doctors. And there's never a cap on that. So for Part B, which is the physicians and a lot of the outpatient care, you continue to pay 20% of whatever the bill is.
Okay.
In Medicare Advantage, you still have some co-pays and co-insurance, but what is available is what they call a maximum out-of-pocket, or a MOOP, which if you do have, unfortunately, a year of large expenses, you are limited on your financial responsibility.
Okay, and there's differences with regard to coverage outside of the U.S. too,
yes,
right?
Absolutely, except in a few rare cases, Original Medicare doesn't cover people when they go on those wonderful European or South American vacations. In Medicare Advantage, many of the plans do have that, and at Medical Mutual, we have a $50,000 emergency care lifetime benefit. So when you are on that wonderful trip, you have a little security that you are taken care of.
Okay, well, what about here at home?
Here at home, it's a matter of co-insurance versus copay. So again, as we mentioned, traditional Medicare copays and a percentage. If it's a $200 bill, you pay 20%. In Medical Mutual's plan and many other Medicare Advantage, it's copay. So every time you see a doctor, it may be $15. It doesn't matter what the bill is. And then again, you have that maximum out-of-pocket protection I mentioned.
Any other differences?
Well, there's many. In traditional Medicare, you have any doctor. In a lot of the Medicare Advantages, you have what are called networks. And I always recommend people to check if your doctor is in whatever Medicare Advantage plan. In Medical Mutual, we have many, many doctors, so it's very likely your doctor and your preferred hospital are already in our network. So it's really a way you can see if your current caregivers are in that network to give you an option.
All right, this has been great information. It does seem the advantage goes to Medicare Advantage plans. Just make sure to find the Advantage plan that best suits your medical and personal needs. And for help, use the information that's coming up next. My thanks to Dr. Koenig for joining us today.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com/2015options, or call 1-866-488-3266. Next.